The White House plans to distribute more than 1 million monkeypox vaccine doses in the next few months. Public health experts are looking to the worldwide coronavirus response as a guide for what not to do this time around. Thomas Bollyky is the director of the Global Health Program at the Council on Foreign Relations. Tom, welcome to the program.
Thanks for having me.
Can you explain the difference between the makeup of the coronavirus and the monkeypox virus and how it's spread?
Absolutely. So monkeypox is the first disease threat really since the coronavirus that's being considered a public health emergency. But in many other ways, these two viruses or threats are quite different. Monkeypox is an older virus. It's an orthopox virus related to smallpox. It spreads less efficiently, kills far fewer people, is a threat to children, pregnant women, and people that are immunocompromised. But the other reason is because it's been around, we have tools to address this. There are two vaccines that were developed for smallpox that could be harnessed against monkeypox. We have a test. There are even potential treatments. And all of that is different from when the coronavirus, which was the new virus, emerged, and we had to create everything whole cloth.
Well, as you said, it's been around, so we do have testing, but the U.S. isn't really doing much of it. Why is that, and is that a concern?
It is very much a concern. Right now, we are seeing an outbreak that has spread. We have nearly 11,000 confirmed cases in 59 countries and territories. And by this, I'm referring to countries where the disease is not endemic. So traditionally, monkeypox has been contained to Central and West Africa. It is now spread to 59 countries and territories beyond that. However, in Europe, where really cases hit hard first, cases are declining fairly significantly, and they've had much better surveillance. And that has helped them identify the risks, be able to communicate public health messaging, to start to roll out vaccines. The U.S., again, like in the coronavirus situation, has been very slow to roll out testing. We are largely still flying blind. Testing was limited to public health laboratories, which is, again, what happened in the coronavirus situation. And we really have a very poor idea of the number of cases we have. We do know they're rising, though. We have over 1,000 to date, but the real picture could be significantly more dire than that.
So how expensive are the vaccines and how hard are they to get?
So the vaccines are fairly expensive, more expensive than in the COVID circumstances, and supplies are limited. Again, we're fortunate to have them right at the outset. So this was an investment the US government had made largely to address smallpox. But because there had been a very small outbreak of monkeypox in the past, we do have an approved FDA approval to use it for monkeypox. But the US has been slow to get doses. There aren't a lot of doses on the global scene. And even the doses we have been stuck in Denmark where they're manufactured because we've had some delays in getting that plant inspected by the FDA.
And there's only one company making these vaccines. I mean, that's not a very stable supply.
It is not. And their production capacity, we're not talking about a company like Pfizer with massive production capacities. Their production is quite a bit smaller. They have very limited supplies, and they're already being bought up by the US and other wealthy nations, which is largely what we saw in the coronavirus situation as well.
So then what about low-income countries? Are they able to access the monkeypox vaccine?
So far, no, they are not. And this is a point of contention really for two reasons. One is that, again, monkeypox is not a new virus, and people are fundamentally uncomfortable with the notion that this outbreak only becomes a concern when it spreads to wealthy nations. That we haven't done very much to respond to this when it was contained to Central and West Africa, but are doing so now. The other part that makes people uncomfortable is many comments have been made in the later days of the COVID pandemic that we need to do things differently next time, that poor countries can't be last in line to get vaccines. We still have a scenario where less than 1 out of 5 people in low-income countries in Africa in general have been vaccinated for coronavirus. Everybody wanted to see something different, yet we are repeating the same circumstances here.
So Tom, aside from it just not being fair, What impact does that inequity have on the global outbreak?
Fabulous question. So what it really affects is our ability to get cooperation to identify future disease threats early and to make the global investments we have to do better than we did in the COVID pandemic. And this is really undermining our ability to convince countries that the next time will be different.
So what are your recommendations then? How does the current response need to change to ensure that we don't have that repeat of what happened with the coronavirus vaccine?
So what we need to do differently is first recognize that this is a different disease than COVID. What we are largely trying to do here, we're still in a situation where this can be contained and eliminated from countries where it is not endemic. That's important because the more this disease spreads worldwide, the greater chance you get mutations, the greater chance it takes hold in other animal populations it might spread to, and then we'd have a really hard time getting rid of it. All that means we should be using the vaccines to contain the spread abroad. Now, that is high-income countries, but to do that, what that means is you need to have an investment in treatment programs for low-income countries that have to happen at the same time. We need to communicate that they're equal priority, but that the needs in this pandemic are different. This is a disease that doesn't kill very many people. It is largely about trying to contain its spread and making sure people get treated as quickly as possible.
All right, Tom, thanks so much for joining us. Nice to talk to you.
Thanks so much.
Thanks for watching. If you enjoyed the video, give it a thumbs up and subscribe to our channel so you don't miss out on any future Government Matters interviews.